Gglaser, and this is the lungs. It's a diagram that I made of the lungs. And first off, I'd like to depress the bottom of it, and this is inhalation. And as you can see, when you inhale, the lungs inflate, they get bigger. And the process of inhalation is the first part of ventilation process of the lungs. So when we breathe in, the air moves in and out of the lungs from the contraction of the diaphragm and the external scalene and intercostal muscles. When the diaphragm contracts, it flattens downward, increasing the volume of the thoracic cavity and creates a negative pressure that draws gas into the lungs through the upper airways of the trachea, which is right here, down into the opening. The intercostal muscles contract during breathing, and during inspiration at rest, primarily is assisted by the diaphragm only. Inhalation brings in oxygenated air through the alveoli to the bloodstream. So it oxygenates our blood. And when you exhalation, I guess, would be when letting go of the bottom part of this, and you exhale, you see the lungs deflate. There are no major muscles of expiration because normal relaxed expiration, exhaling, is passive and requires no muscular effort. The accessory muscles of expiration, the abdominal and the internal intercostal muscles, assist expiration when when minute volume is high during coughing or when airway obstruction is present. When the abdominal muscles contract, intra-abdominal pressure increases, pushing up the diaphragm and decreasing the volume of the thorax. Exhalation, when you exhale the air, it allows CO2 from the venous system, from our blood, to be transferred to the alveoli and be expelled out of our mouths, releasing CO2 gases as we exhale. Once again, exhaling. Let go of that. The lung capacity is the amount of the lung capacity can vary from age, gender, ethnicity, as well as genetic or physiological impairments. It is true that taller people have a greater lung capacity than shorter people just because their thoracic chest size is considerably larger. The lungs mature around the age of 25, and after the age of 35, it is normal for the lung capacity to gradually decline as you age. The muscles of the diaphragm can also become weaker. Lung tissue can lose its elasticity, which also means that your airways can become smaller. Another physiological change is that your intercostal muscles, along with your rib cage, will decrease in size, which leaves less room for your lungs to expand. How asthma affects the lungs. Asthma attacks are usually triggered by allergens or some kind of allergy, which constricts and narrow the bronchi and the bronchial tubes, which are these tubes right here, causing inflammation and a wheezing sound. The inflammation and swelling, along with secretions, can partially occlude the airways, which makes that noise when you breathe out. It's a wheezing sound. It's like a high-pitched noise, wheezing. You know it when you hear it. This makes it difficult for the individual to effectively get air into their lungs and receive enough oxygen into their bloodstream. Also gives them a high sense of anxiety, and a lot of times they can go into hyperventilation or respiratory alkalosis if you're not careful. Priorities for the individual with an acute asthma attack are to give them a couple of puffs of albuterol, which is a beta-adrenergic bronchodilator. This will help dilate the bronchioles using the agonist albuterol. Inhaled bronchodilators and oral corticosteroids are the mainstays of treatment for mild to moderate asthma attacks. Monitor the patient's vital signs. Tachycardia is a common side effect. Most symptoms will improve within an hour of starting therapy. Teach the patient the importance of a follow-up with the healthcare provider, and oral corticosteroids will be part of the discharge plan for a moderate attack, and based on the patient's history and their preference, sometimes for a mild attack. After the medication is inhaled, you want to sit the patient up in the high Fowler's position, which is at a 90-degree angle, for maximum chest expansion, and try to keep the patient calm, relaxed, to prevent any anxiety from the situation. You don't want them breathing extra. With patient teaching, it is important to involve the patient's caregivers. They should know where to find the patient's medications. Teach them how to use the inhaler when an attack comes on, or if they're starting to feel a little congestion or slight wheezing. It will help them ease the patient's anxiety to cure the attack before it even starts. When the patient is stabilized or controlled, the caregiver can gently remind the patient about the monitoring the peak expiratory flow meter and asking questions. What zone are you in, or how's your peak flow today? It's also good to avoid cold weathers when possible, and to know what over-the-counter medicines like aspirins and some non-steroidal anti-inflammatories can affect your wheezing and actually cause people to have asthma attacks. It's also important to have good nutrition. It's important for physical exercise, swimming, walking, stationary cycling. Of course, what the patient can tolerate is beneficial for them. It may require a pre-treatment with an albuterol inhaler as well. It's also good to get uninterrupted sleep. You can't overstate the importance of how a good night's sleep is for these patients. If the patient has asthma, reports lack of sleep because of asthma, they're not under good control and they need to be reevaluated. The good news is there are many resources available to help you learn about asthma and how to manage the disease. Many are right here within your community, and a lot of them are websites that you can look up quite easily. People and organizations that address asthma in the community are usually your doctor is a good place to start, any of the nurses that you know, and then there's local health departments that you can look up as well for state and local and federal levels as well. You have specifically you have the Asthma Community Network, you have the American Lung Association, and then you have the Asthma and Allergy Foundation of America. These are three very common sites that you can go to that can also connect you with local and state resources. These are some of the muscles that you use when you breathe in and out. Let's just go back over that. There's the diaphragm, and then the scalene muscles. I thought that was very nice. I like how it talked about the chemoreceptors in your brain that actually trigger my breathing. Very great. And it goes into, here you go. It shows the pleural area in the diaphragm. I think this is a really good picture right here of how the lungs are working from a medical standpoint, and then down to the alveoli. All right, there you have it. That is my lung and asthma, assignment, and I hope you enjoyed it. Thank you very much, and good night. Hello. Once again, I'm back just to check on my screen. I don't know if I could figure it out and see what was really going on. Thank you.